Warning, this content may be disturbing to some audiences. Subscribe, if you dare. My patient came in complaining that her skin turned blue. Turns out she had been ingesting colloidal silver with the belief that it would prevent infections. Hey everybody, welcome to ANECDOSED. People ask Reddit. Doctors, what is the worst homemade cure a patient used for their illness? Number 1. An older woman with a big, gaping foot ulcer visited her family in Indonesia. Her sister took her to a spiritual healer, who instructed her to make an ointment and apply it to the ulcer. The ointment included herbs, sheep urine, olives, human hair. The day after applying the ointment, she was to cleanse the ulcer in the ocean. After a few weeks of this, the ulcer would heal. Obviously it did not heal, and a rare mycoplasma bacteria found only in the ocean grew in her wound, and she lost her foot. Number 2. Commenter. I knew someone who got cancer and decided to starve it instead of taking chemo. First results after the 40-day fast were promising, but not for long. He died in less than a year. The sad part is, the survival rate with chemo for this type of cancer is really high, and it was detected quite early. Person B. I know someone who's self-diagnosed with cancer and is currently on water and food fast. I haven't seen him in a while. This reminded me to check in with him next week. He has not been to a doctor nor been diagnosed with cancer. He doesn't believe in chemotherapy. Number 3. Had the fortunate luck to be privy to a patient's super duper secret way of getting rid of leg cramps at night. Get a cork, not just any cork though, it must be from a bottle of red wine, and tuck it in between your toes at night. He was very sure that was the cure that Big Pharma wasn't telling us. Completely irrelevant that he started taking a magnesium supplement at the same time as his newfound super cure of toe cork fondling. So Big Pharma, if you're reading this, we all know now. Number 4. Told patients to apply cream to their feet. They ignored my advice and just kept rubbing garlic over it. They later came back and I told them their foot is getting worse because they aren't using their cream and they now need to go to hospital. They ignored me and kept just rubbing garlic. Eventually they lost their foot. Number 5. Dermatologist here, dude was trying to get rid of his papilla pustulosa acne with a homemade mask, which consisted of a mix of betamethasone ointment, honey, cream cheese, yogurt, banana, and makeup and cream for color. So many bad things here, and the dude developed a nodular cystic acne after 3 or so applications, which he did daily because of course. Who suggested this abomination? Various YouTube videos and his own initiative of mixing everything in a bowl to cure faster. Number 6. My dad had heard of the garlic clove in the ear treatment against ear infection, so he decided to try it on himself. In his wisdom he also decided that crushed garlic must be much more effective than a normal clove. He needed a lot more treatment for his garlic-induced burns than what the infection would have required on its own in the first place. Number 7. Paramedic. Once had a patient diagnosed with a cancerous growth on his ear. He took care of it himself with fingernail clippers. It got so infected by the time he called 911, we could see his jawbone through his cheek. Number 8. I had a woman come in for chest pain, and when I was interviewing her for her medication history, she was telling me how bad the pain was that she took everything in her medicine cabinet. I asked her to list what she has in her medicine cabinet / what she took. The list went: Tylenol, acetaminophen, 2 tablets, Advil, ibuprofen, 2 tablets, aspirin 2 tablets, heroin 1 to 2 points, Gravol. At which point I kind of had to go, hold up, you used how many points of what? And the patient very matter-of-factly stated that she came in because the heroin didn't help with the pain at all. Which in some ways I guess was a pretty reasonable course of action, since she came in since the heroin didn't work. Number 9. Commenter. I used to work in a rural magnet hospital in the south. Had a patient who was there because he'd gotten athlete's feet and decided to use an old mountain remedy: soak your feet in vinegar, lemon juice, and boiling water to kill the fungus. In fairness, the original remedy probably called for merely hot water, but the guy went a little overboard with the temperature. He gave himself some nice bilateral third-degree burns on his feet. But there was no sign of any athlete's foot, so he had that going for him, which was nice. Person B. Had a woman come in who had what was likely an infected follicle right next to her labia. She thought it would be a good idea to heat up a needle with a pocket lighter to sterilize it and poked it. I saw her after her first treatment, caused a big old tunneling infection around 1 centimeter in diameter parallel to her vaginal canal, stuck a big Q-tip in probably 8 inches before I hit the end when I was repacking it. Number 10. Commenter. Had a patient with a breast infection. She attempted to treat it with Neosporin. When she finally came to the ER, there was just a huge gaping hole on her chest where the breast used to be. The smell in the room was overpowering, to say the least. It turns out you can't cure breast cancer with Neosporin. I don't know if she survived or not. Person B. During my nursing training 30 years ago, there was a little old spinster Jewish woman with a large fungating tumor on her breast that she had obviously been trying to hide for many years. Apparently she would go into her local chemist and buy sanitary pads all the time. As she was really old and well past menopause, the chemist asked her what she needed them for and discovered she had a bleeding tumor on her breast. There was no breast tissue, just this bleeding tumor there. She was severely anemic, given blood transfusions, and was sent to theater for a mastectomy. Obviously had not explained why she was going to the theater, as once there she refused to sign the consent for the mastectomy as she said she was too old. I suppose she was just made palliative. Number 11. Had a patient in my internship year who tied a copper wire around his penis multiple times, and left it that way for a few days. When he was brought to the hospital, the penis had undergone pretty bad ischemia. An amputation had to be done. Number 12. I'm a urologist. I had a patient come into the ED with wire wrapped around the head of his penis. He attached this to, what I think were, popsicle sticks and another band of wire around the base of his penis. It was like a penis splint. He said it was to give him erections. The wire had eroded through his skin and his corporeal bodies were exposed as well as his urethra. This actually appeared to be just ischemic necrosis and wasn't even really infected. It was copper wire. Yes. He was homeless and mentally ill. I removed all the wire that had literally eaten into his dick. He had a 2 or 3 centimeters erosion to his urethra. It just opened up proximal to the glands. He could pee fine out of it. It just sprayed everywhere. The base ischemic area wasn't through the urethra, just the skin. Honestly, to fix that is a lot of work. Buccal grafts for the urethra and likely skin grafting. They have to heal carefully over a catheter for weeks. This wasn't the kind of guy who was going to do that. The dude stayed in the hospital a few days for psych eval and was deemed competent, and he took off. I never saw him again. Number 13. The number of folks who think WD-40 will help arthritis pain is abnormally high. Also, though this is not explicitly a home remedy, but the people who think things will just cure themselves with time. Yes, this works sometimes. Yes, healthcare is financially prohibitive, but if something has been debilitating you for more than 72 hours, it probably won't be going away anytime soon. Just go get it checked. It's cheaper to treat something over time than to go, oh, if I suddenly need $500K for this procedure or I'm gonna die. In studies they exposed rats/rabbits to it by applying WD-40 directly to the skin with an occlusive cover, kinda like the plastic wrap you put over food, for 6 to 24 hours, multiple days at a time for several weeks. This impaired renal, pulmonary and hepatic function, ultimately causing death. A couple of acute dermal exposures probably wouldn't cause too many issues long term. The MSDS for WD-40 is basically divided into 4 of its major components. 2-butoxyethanol, isobutane, isopropanol, D-limonene. None of these components are known carcinogens. None of these pose any known reproductive hazards. Some studies cite the LD50, quantity of toxin to kill 50% of subjects, for 2-butoxyethanol in rabbits at 490 kg/kg for dermal exposure and 1,480 mg/kg for intraoral exposure. Isopropanol was at 12,800 mg/kg for dermal exposure, rabbits, and 5,045 mg/kg for intraoral exposure, rats. D-limonene only has data for intraoral exposure in rats at 4,400 mg/kg. No toxicity data for isobutane. Number 14. During my medic course, one of the other students said that she put coffee on a second-degree burn her friend had. The instructor's mouth just dropped to the floor. Instead of cleaning it to prevent infections, putting coffee has the reverse effect. Do not do that. Number 15. My patient came in complaining that her skin turned blue. After ruling out that she was a Smurf, I asked her if she was using any alternative products. Turns out she had been ingesting colloidal silver with the belief that it would prevent infections. Number 16. Commenter. Worked in the medical field. Yogurt up their vag for yeast infection. Person B. Vaginal probiotic suppositories work pretty well in curing yeast infections and other vaginal flora imbalances. Even oral probiotics have a cure rate that's comparable to antimicrobial therapy, and there's a lower rate of recurrence. So no, it isn't crazy. You just would like a more pure and concentrated source of lactobacillus. Like a vaginal probiotic suppository or oral probiotics. Source: I am a clinical microbiologist, and my personal passion is vaginal flora imbalances. I could find actual research sources, but honestly I'm too lazy to go back into the papers from my master's program. Number 17. Dentist here. I know a guy who lost a tooth, got the tooth, put some home building cement on the root, put it back in the alveoli and showed up a week later with a massive infection. He lost the tooth, 2 neighboring teeth and some part of his jawbone. Number 18. I'm a CNA working on becoming a nurse, but I work alongside them daily. Had a male that came into the hospital complaining about his backside. Had a huge ulcer and was determined to be a complication from him being diabetic. He adamantly refused that he was diabetic and would not allow the hospital to treat him for diabetes because he was a truck driver, and if he had to take insulin he would lose his license apparently. So he kept insisting that he just needed some, in his words, a salve to put on this giant ulcer because he's done it before and it worked fine, so he said. Results came back from the ulcer and found he had MRSA, which was causing it to be even worse. He refused to believe the multiple doctors that tried to help him understand that he was diabetic, needed to treat that, and needed to treat MRSA with a hardcore antibiotic regimen. He refused, checked himself out AMA, then showed back up like 2 weeks later in an ambulance that a friend called for him because he went septic and was in a really bad way. Why do you go to the hospital just to refuse everything that doctors and nurses have seen for years? He was putting bacitracin on his decubitus ulcer with MRSA in it, until he basically couldn't move because he was drained of all energy. Ended up having a whole lot of his buttock removed. Not sure what happened to him after that. Number 19. Alcohol for a 3-year-old. Let that sink in. The parents told me that when their child had a cold, they gave the kid vodka mixed with some herbs. To top it all off, they were anti-vaxxers. I haven't had dumber patients since then. Number 20. Patient had severe multi-vessel disease which required open heart surgery. Her daughter, who was a naturopath, adamantly refused and said her mom just needed to eat Greek yogurt and would be fine. Patient declined treatment per daughter's recommendation and died a few months later. The daughter then became a patient years later. She had disfiguring breast cancer that had gone untreated so long that she had mets all over her body including bone. The cancer had leached so much calcium from her bones into her bloodstream that she was rigid/spastic, barely able to speak, and had severely altered mental status that caused her sister to call 911. Really sad that she was in such denial and let this go untreated for so long. Not quite sure if she tried home remedies for breast cancer. She claimed she didn't know despite her breasts being insanely disfigured from the cancer. Not sure what ended up happening to her. Make sure to share your personal story in the comments below and have the opportunity to be featured in a future video. Also, if you like these topics, don't forget to like, subscribe, and hit the notification button to continue seeing more content like this every day. See you next time.